Our TCM clinic sees a lot of young adults with gastric problems, including Irritable Bowel Syndrome, also known as IBS. Many of them have seen Western doctors for some months or years and are taking omeprazole, antacid, and Zantac. Patients who come to see us for such problems usually complain of stomach discomfort, flatulence, heat sensation, or discomfort in the center of their upper abdomen. Those who suffer from IBS tell us that they often have to go to the toilet soon after meals. Some patients experience stomach discomfort when they are hungry or stomach pain after a meal. Through gastroscopy, some were diagnosed with having excessive acid in their stomachs. In some cases, they are diagnosed to have inflammation of the stomach lining, ulcer, polyps, or H.Pylori. Some patients had gastric problems for some time and they were worried that it may lead to stomach cancer. Traditional Chinese medicine, also known as TCM, adopts many ways to treat gastric problems. We administer acupuncture, expel wind using cupping method. We also prescribe herbal medicine for the patients. At the same time, we advise patients to refrain from eating spicy, oily food, hard nuts such as peanuts, alcohol, cold drinks, yellow noodle, and chocolates. Instead, we advise them to take bland and easily digestible food when they experience IBS. For those who have serious gastric problems, we even advise them to drink mineral water during the gastric attack. We also tell them that the cause of the gastric problem is due to poor eating habits over the past years. As people need to eat every day and the stomach does not rest, therefore, it takes some time for the stomach to get well. A bank manager in his 40s consulted us as he had a very bad gastric problem. He had seen his Western doctor for 4 to 5 years, but his condition did not get better. His colleagues from China had recommended that he consult a Chinese physician for his gastric condition. They told him that TCM is good in treating chronic gastric problems. His stomach always had wind and he often burped and let off gas. When he attended company meetings and needed to participate in discussions, he felt that he could not speak too much, as whenever he did so, he would feel a gush of gas coming up to his throat, which made it difficult for him to talk. Whenever he raised his voice to reprimand his staff for doing something wrong, he would immediately feel a gush of gas coming up from his abdomen up to his throat. He said that he was very sensitive to many types of food and often felt embarrassed whenever he went out with a group of colleagues for lunch. He came to see us and had 15 sessions of acupuncture treatment with cupping. We also prescribed herbal medicine. As his condition gradually improved, he faithfully underwent 20 sessions. At the end of the treatment, he was happy to find his gastric problem cured. To know if you have gastric or IBS problem, ask yourself these questions. 1. Do you find that your stomach is very bloated or have a lot of gas? 2. Do you experience stomach pain immediately after food or find it difficult to finish your meal without any discomfort? 3. Do you feel discomfort at the center of the chest or experience difficulty in breathing after food? Dr. Ong Swee Ling has graduated with a doctorate degree from Nanjing University of Chinese Medicine. She has 20 years of clinical experience in practicing TCM. Together with a team of TCM physicians, they treat gastric pain and IBS with acupuncture and special herbal prescriptions.